covering all of the non-surgical, minimally invasive options that we offer over there. So first things first, I wanted to give you guys a little background on what causes cellulite, because I think when you understand what causes it, you'll be able to understand our treatment options a little bit better. So a lot of people think cellulite is a fat issue. It's not a fat issue. Victoria's Secret models have cellulite. So this is not anything to do with your, you can't work out enough to get rid of your cellulite. You can't eat healthy enough. It's just unfortunately part of a lot of women's genetic makeup. So what causes cellulite is actually these fibrous bands, and they're collagen bands that pull down on the skin, kind of like an anchor. So hypothetically, you would think if we could cut that band, or if we could dissolve that band, all of a sudden that anchor releases and the dimple releases on the surface, and it leaves a flat surface instead of a dimpled or rippled surface. So that's actually what causes cellulite dimpling. And like Dr. Horowitz mentioned, 9 out of 10 women will deal with this in their lifetime. So it's very common. It's one of probably our most common complaints on the BioSpa side in terms of body contouring. So it's important to differentiate what does real cellulite look like, because I will say the far left photo is one of like my most popular complaints. People come in and they're like, I'm frustrated with this dimpling, but it's important to note that is it true dimpling, or is it actually a little bit of skin laxity, which we have other procedures we would recommend more for skin laxity rather than true dimpling. So the middle you can see is more stretch marks, and then of course excess fat. So it's important to book a consult just so that we can see, is it true dimpling or what exactly are we dealing with. So the first product I'm going to talk about is Quo. This came out in July of 2020. It's been at our practice for about 4 months now. It is a brand new cellulite reducing injectable. So up until this point, we've had lasers, we've had Selfina, we've had surgery. We've never had an injectable that actually treats cellulite. So Quo is essentially a collagenase, which is a type of enzyme that dissolves that fibrous band I told you guys about. So what we're doing is we're injecting right into the dimple, and that dissolves that band. So that puffs up the surface, just as I mentioned. So it releases that anchor per se. Quo is dosed in a total of 3 treatments. We recommend doing these 21 days apart. And then during your initial consult, we'll kind of assess the buttock, and we'll see how many dimples we're dealing with, and either recommend a half moon package, which treats 12 dimples per session, or a full moon package, which treats 24 dimples per session. The clinical trials were done on moderate to severe dimpling. So that was really reassuring to me as a provider, seeing pretty severe cases of dimpling and seeing that they actually got really good results from it. Because a lot of times with clinical trials, you see people with like, that were already semi-perfect, and then you did this clinical trial and it's like, well, okay. But these people had pretty severe dimpling to start with, and you'll see some of the before and afters. They're pretty impressive. So what to know before you Quo? This is actually my bottom. So I can speak anecdotally from my own experience that the procedure itself, very easy. The needles are 32 gauge needles. It's a very comfortable procedure. So you're not gonna have to worry about, taking any medication the day of your procedure. You're kind of in and out within 45 minutes to an hour. What I should mention though is post-procedure, there is quite a bit of bruising. So we tell our patients there's moderate to severe bruising to be expected. And a lot of that has to do actually with that fibrous band. It's surrounded by a bunch of venules or veins. So when you dissolve that band and it bursts, so do those venules, and that causes a ton of blood pooling in the area. So this isn't from traumatizing injections. It looks a lot worse than it actually is. Like I said, the injections themselves are very, very easy and very painless. So aftercare is really important with this, since obviously you wouldn't want to plan to do this right before a vacation or somewhere where you need your bottom looking like really good, or where you have a vacation coming up. So we do actually recommend this as kind of a wintertime procedure or early spring, just so you have that time before summer. So summer 2022, it's crazy to say that, it's right around the corner. So great to kind of foresee that. Lastly, in regards to the bruising, we do have an Ipl Laser, which helps target bruising. So if hypothetically you had an event in, let's say, 8 weeks, and you're like, I really can't deal with this downtime, we do have options to mitigate the bruising and to help it go away a little bit quicker. So we do have some options to speed that along. So here are some before and afters. I think right hand one is really impressive, seeing all of those dimples on the right cheek compared to the bottom. But you can see just before and after, the bottom in general is much smoother. Those dimples are much less apparent. So these patients all receive the 3 treatments 21 days apart. So we do recommend that dosing schedule for our patients. Next, we're going to talk about VelaShape. This is one of my absolute favorite devices because it's kind of like a 3-in-1. So VelaShape is a radio frequency device, and it uses 3 different components. So it uses vacuum suction, it uses these kind of massaging devices, and then it also uses radio frequency, which is thermal energy, to heat up the tissue. So as we're heating up the tissue, we're increasing blood flow, we're increasing collagen, we're also mitigating the appearance of cellulite and dimpling and skin laxity. So this is really an option for a lot of patients that have more than one issue. So like that first cellulite slide on the right where I said a lot of people come in with this, VelaShape would be a wonderful option for that patient because they might have some minimal dimpling, but they really have skin laxity. I also see a lot of patients post cool sculpting at other offices that come in and now the fat's gone, but they're dealing with skin texture issues or they're dealing with laxity. That's where VelaShape can really come in, and I call it like my shrink wrapper. It kind of just like shrink wraps everything together and helps with a lot of that skin texture. It is about 45 minutes to an hour based on which area you do, and it really, I think it's honestly, I tell Shakiba, who is doing it on me right now, it's my favorite part of the week because it feels like a deep tissue massage with hot stones. So it's really relaxing, and it's very, very comfortable. Most of our patients do really well with it. It is dosed once per week. So this is one of those procedures where we do need a little compliance on the patient end, just because we have to book those 6 sessions in a row. Once per week is really important to see optimal results, and we recommend a series of 6 to start. Many of our patients go on to do 10 to 12 sessions, but 6 is the recommendation to start. And then most of our patients will see results about halfway through their package. So by session 3 or 4, they'll say, wow, I'm really getting a lot of compliments on my legs. And a great combo therapy with the quote. So you address maybe more severe dimpling, and then you address skin tightening with the VelaShape. Next is Thermi Smooth. This is very similar to VelaShape. It just doesn't have the vacuum suction or the massaging devices. And ergonomically speaking, the handpiece is a little bit smaller, so it's meant for a smaller surface area. So we're able to treat the neck area, the abdomen, the inner arms. A lot of times I actually couple this with VelaShape. So I'll do VelaShape on the upper thighs, and then I'll do Thermi Smooth around the kneecap for that skin laxity that you get right above the kneecap, because the handpiece is a little bit smaller and it's easier to get into those small spaces. So this is once again about 15 to 40 minutes based on treatment area, and it's the same exact technology as VelaShape, the radio frequency. Same dosing, we recommend to start with 6 sessions. And as I mentioned, majority of our patients, I would say mix and match. So they'll do VelaShape posterior thighs, and then maybe Thermi Smooth side of the thighs and upper kneecap. But my nurses and I kind of collaborate, and we customize your package to, give you the most beneficial results. So moving on to non-surgical BBL. So this was kind of what I was speaking about with Carla. If you're on the leaner side and you're like, I really want that plump Kardashian booty, but I don't have the fat to take from anywhere, we can use an agent called Sculptra. And Sculptra falls under the family of filler technically, but it does not act like a filler. So it's a collagen stimulator. So what we do is we inject this agent, and it stimulates your body's own collagen over the course of 3 to 4 months. And over the course of 3 to 4 months, that booty builds up, and you get that nice plump kind of BBL look. Obviously the results are not nearly as severe as a BBL since it's not surgery, but we see pretty remarkable improvements with this. It's great also for people who do maybe have the hip dip or have specific areas they're looking to target, because we really can kind of spot treat with this. And it does last two years, if not longer, since it is a collagen stimulator. It lasts the length of your collagen, which is amazing. Also for patients who, maybe just aren't a candidate for surgery, whether they're on various medications, whatever it may be. The dosing, we typically break it up into 2 separate sessions, and we like to do those sessions 12 weeks apart. Reason being, it does take about 12 weeks to see the results from those initial injections, and oftentimes patients will be happy after that first session, so they may not feel like they need the second session. But anywhere between 6 to 12 vials total for that non-surgical BBL. And as I mentioned, the results appear over the course of 3 to 4 months. So, lastly, we're gonna just talk about a couple body care options. So I always tell my patients, especially my VelaShape patients, if you're coming in and you're addressing cellulite or skin texture or laxity, and you're already gonna be moisturizing at home, you might as well make your moisturizer something somewhat prescription strength, so something with retinol that's gonna help with cell turnover. The papain, and I can't even say that word, but they are both different ingredients that are gonna help with cell turnover and help boost collagen production. So if you are already using a normal lotion at home, these ones are priced at $79. I think it's a great add-on. In addition, the Environ products, which we all speak very highly of, the ACNE oil, but these are amazing just to kind of couple with your treatment and use at home on your own to just enhance those results. And then the Cellulite Control cream by Zio, this also helps visibly improve skin texture, and interestingly, it upregulates the fat-destroying enzyme. So if you are getting a little bit of fat loss with VelaShape or Thermi Smooth, this is a great product to couple with it to kind of stimulate that further. So I hope I didn't talk too fast. I have a habit of doing that. But does anybody have any questions?
No, that was a great job, thank you.
Good job, very good.